This is Xinlun Tian from Peking Union Medical College Hospital. I'm a pulmonologist. And thank you for CFRI's invitation to share our story of cystic fibrosis in China. And let me have my slides first. I'd like to share my story about cystic fibrosis in China. When I first encountered this patient, it's around maybe 17 years ago. This patient was a 16-year-old boy, and he had bronchiectasis and pneumonia, and he was admitted to our hospital. But when we reviewed his past history, we found he had pneumonia only 5 days after birth. And he was admitted to hospital because of pneumonia annually. And he had diarrhea after 8 months after birth. And he was diagnosed at steatorrhea at the age of 7 years old. At that time, we don't think there's any CF patient in China. So though he was admitted to our hospital multiple times, none of the physicians think he had any other disease besides bronchiectasis. But we reviewed his past history, and we think maybe cystic fibrosis is a possible diagnosis. And we talked with the boy's mother, and the mother told us the boy had salty sweat particles on his skin when he was in hot weather. We don't have sweat test at that time, and we review the reference from the Western world, and we perform the sweat test by ourselves. It's really difficult work, but we done it. And his sweat test was much higher than normal, and the cystic fibrosis was diagnosed in our hospital for the first time in 2006. After that, we found more CF patients in our hospital, and we summarized of the characteristics of the patients. And I was invited by American Thoracic Society in 2013, and we got the ATS China International Development Award at that time, and we had the poster discussion in the conference. And we summarized the 7 patients of CF in our hospital, and this paper was published in 2015 in Respirology. And we found there's some difference of the clinical symptoms from for our Chinese patients from that of Caucasians. We don't have a lot of gastrointestinal symptoms in our Chinese patients, and ABPA is much common in our patients. It's interesting. And this paper was chosen by the Respirology as an editor's choice. And we found the genotype is much different from that of in Chinese, from that of in Caucasians. And for the first time, we found G970D is the most common mutation in Chinese population, which was not found in Caucasians. We'd like to estimate the prevalence of CF in China. We reviewed all the published literature and found only 200 cases were reported. And there's no reported prevalence rates based on population survey. As we know, CF is the most common inherited disease in Caucasians. But the prevalence in China is still very rare. We make some estimation of prevalence in China based on our health database, and we found maybe the carrier should be 1 to 127, and the mobility is maybe around 1 to 64,000. Another estimation from the Shanghai Center, they found a similar, a little bit less than our estimation, but both of the two estimations not include the large gene fragment deletion and the duplication events. So we think based on our big, huge population in China, there should be more than 20,000 CF patients in China, we think. So we think CF is not as rare as we expected in China. We are wondering why lack of reported cases in China. Yeah. I think maybe the genotype and phenotype in Chinese are different from that of Caucasian. It's a big issue. Another big issue is at that time we lack of national registry cohort. And as we mentioned as before, the mutation in Chinese is totally different from that of mutations in Caucasians. Here I show you the 5 hot mutations in Chinese and in Caucasians. None of them are overlap. So using the gene panel established in Western world is not suitable for Chinese patients, I think. And we are wondering, is it suitable to use diagnosis flowchart from the Western world? In the slides, the left side of the slide is a flowchart from the Western world. We all know we have some newborn screening system in Western world, but actually it's not cost effective in Chinese because the CF is such a rare disease. We don't have to do the newborn screening in China. And another big problem for Chinese patients is only less than 10 centers have the sweat test in China. So some of the patients don't have the access to do the sweat test. We suggest such patients can directly perform the CFTR gene test. And if they have the definite pathogenic mutations of biallelic CFTR, the CF can be diagnosed. But we do suggest all the patients to perform the sweat test because it's a functional test, and some of the mutations are different, and it's difficult to tell it's likely pathogenic or pathogenic. Some of them are only UVS, so it's difficult to make the diagnosis based on only for gene test in Chinese patient. So at that time, we refer the CF patient, suspected CF patient, to CF center to do the functional test in China. I'd like to introduce the CF history in China. The first cases was published in 1974. It was made by autopsy. And the first confirmed case by gene test is in 1995. And as I mentioned before, the first case diagnosed in our hospital is 2006. And after that, we are trying to use a sweat test to make the diagnosis. And right now, we have the routine clinical pathway for CF diagnosis in our hospital. And another two big events in Chinese CF patients history is we have the National Rare Disease Registry System in 2016. And after that, we collect more CF patients in the registry system. Right now, it's nearly 100 patients in the registry system. And another big event is China Rare Lung Disease Alliance was established in 2019. And we think we have more and more resources in the future. Last year, we are starting to write the Chinese experts consensus statement of diagnosis and treatment of cystic fibrosis in China. This is the first consensus statement in China. And it was published only 2 months ago. It's a newly publisher. And we raised 38 questions from our physicians, nurses, and also from our patients. And 38 experts involved in this statement. And we finally made some standardized consensus statement for CF in China. Here is our plan. We are trying to establish at least 10 CF centers in China. And we are trying to make more cases diagnosed. Our plan is 10,000, but I think it's a tough way to go. And to make the standardized diagnosis for CF in China, I think maybe sweat test machine is a very useful way to make the diagnosis. And we do need the CF machine, sweat test machine donated. Yeah, that will be very helpful. And right now, we are conducting treatment research targeting the type of CFTR gene mutation, specifically in Chinese. We already have G965D knocking mice, which is mimic G970D patients in Chinese type. And the phenotype of the mice have been identified right now, and we are trying to do some gene function test for the mice, and we are trying to do some gene modification in the future. And we do welcome all the researchers to contact us to do some gene modification for the specific gene found in Chinese patients. That's what I'd like to share. And I'd like to thank for our team and our patients. And I'd like to thank for CFRI, thank for them to provide such opportunity to share our story here. Thank you.